Let's talk this through with a consultant physician and infectious disease specialist, Dr. Getty Nyaoke, who's joining me to discuss this emerging cases. Thank you so much for joining us on World Now. If the fears that Christmas travel will fuel spread of Omicron, according to the US experts, is that to say that we'll be having serious post-Christmas COVID chaos as we had it when it first broke?
Hi, good afternoon. Thank you for having me on your broadcast. I would say everybody should take a deep breath. We're in a little more different place than we were exactly this time last year. Omicron is really rapidly spreading, much faster than the Alpha version and even the Delta version, because a couple of weeks ago we had 0.3%. By the last week we had 3%, and Monday we were told by the CDC that we have about 73% of the population of the US that are getting the virus to be Omicron. So the thing now is that we have better tools. People should take the vaccines and the boosters and do all the other mitigation measures. But as for it being exactly like last year, it may not necessarily be so, because Omicron is, the virus is already in our community. What people need to do is to be a little bit more careful. Now, I know in places like Nigeria and other African countries, we haven't had that much vaccination. And that's actually the main concern that I have. Because we haven't had that much vaccination, people should be much more careful. But I think a lot of people have been exposed, and as long as we're taking good measures, it shouldn't be as chaotic as it was last year.
Well, in Europe, for instance, France and Germany are among those to issue travel restrictions, and the Netherlands has imposed a strict lockdown over Christmas. What more actions would you suggest to be put in place? I mean, do people really have to travel, considering the risks involved? So, as of the time COVID first came and started, we didn't have much tools. We were in a different place. And so we could make much more restrictions and say people shouldn't travel, people shouldn't do this, shouldn't do that. Right now, we can look at it on a case-by-case basis. What are the circumstances for that area? And we can make those decisions for that area. So it's not going to be a one-size-fits-all. It's what is the specific peculiar situation of the area we're talking about. I think that's how we should be looking at it going forward. Well, a whole lot of people are still affected by vaccine skepticism, whether we like it or not. They argue about the reason they should still be affected by COVID and even die in some reported cases. If this is what it is, why then should they even get a jab? Do you also share the same sentiments with them?
Well, people need to get more education about it, and I'm always willing to explain. Yes, vaccines are not 100% protective, has never been. Look at the cases of other diseases that we've had vaccinations on in the past. It's never 100%. What it does do is reduce our risk. Now, people do get vaccinated and may still die. You have to look at the context, who the specific person is, what were their comorbidities, what other medical problems they had. I give a very clear case of General Colin Powell. He had the vaccine, and he also had other medical problems. He had prostate cancer. He had also a blood cancer. For those people, we already know that the uptake of the vaccine is not as good as it is with the normal population. So in some cases, it might be less than 40%. In the normal population, you can have 90-something%. That's how we can look at those cases, case-by-case basis. It depends on the context. So I would tell anybody that's out there to go get the vaccine, because it does minimize our risk for infection. And even when we get infected, it minimizes the risk for severity, hospitalization, and even death. Well,
there has been over 800,000 deaths recorded in the Western world. I really don't know how people are, how they are living with the COVID-19 virus and the Omicron as well, when it comes to taking all those pharmaceutical measures and all that. But here in Nigeria,
there are a lot of people who are walking on the streets who are not using their nose masks, they're using their face masks, washing their hands, still going about the way they used to do pre-pandemic. And they say something like, nobody drops dead on the road. Nobody just died of COVID-19 compared to, what obtains in the Western world. On whose table does the buck stop at this time round? Who should be taking this, first? You talked about education, but here a lot of people feel it's just a scam.
I know, and it's so unfortunate. It is really unfortunate. I think that we need to do more. The government, whether federal, state, local, the academicians, the academic institutions. It's an all hands on the ground approach that we should be taking in Nigeria and other African countries. We all need to educate each other. We all need to explain it to the market woman and the person that's at the pub and the person that's at the restaurant. I know that there's a lot of skepticism, but I also feel that we need to do a little bit more in educating our population about the effects and other things about COVID.
Well, I really don't know whether you agree with the WHO chief, Dr. Tedros Adhanom Ghebreyesus, who said that it's better to cancel now and celebrate later than to celebrate now and grieve later. And that's something pointing towards, the festive season which we are in. And a lot of people want to travel. They want to go to meet their families. They've been away for more than a year. So would you say that people should rather celebrate on a low key without traveling, stay back where they are, or go home and observe certain measures? What would you be advising at this time?
Generally, I would agree that it is safer to take these measures of not mingling with more people, especially around this time. That would be the general thing. We've done this though last year. So I would say again, there's no one size fits all. In a place like Nigeria, I hesitate, and Nigeria and other African countries, I understand what WHO is saying, because those areas don't already have enough people vaccinated. In fact, I think Nigeria is about maybe less than 2% of the population vaccinated. So those measures have to be taken in-country measures. A country like Nigeria, I would agree that people should at least scale back for now and let this period, this hump go through. This is just another wave, yet another wave. Let it go through, and then that way we can, come out of it with our families intact and without losing many lives. I would agree to a large degree.
Well, those of us that are in the metropolis, we educated to some level, we understand the effect, the impact of COVID-19 on economics, on everything that we do. But those in the rural environment, they probably do not really get the gist. They feel that what they are also facing, farming, the climate change, etc. And you talk to them about COVID-19 and they look at you like, what are you talking about? So where should we begin to draw the line? Where should we begin to send this information so that they need to understand the impact of COVID-19 more than the way we do in the metropolis?
Yes, it's sadly very frustrating. I will tell you a little bit about me. I happen to have chaired the COVID-19 task force back in my area, in the rural area of Imo State, from here. And it opened my eyes a lot with how our people see COVID, especially in our rural areas. There are so many issues that they have that COVID and the infection seems to pale in comparison to the other issues that they have. So it's a multifaceted issues, and I would say it's a hydra-headed problem, because somebody that is hungry, that hasn't seen some food to eat, that have children to feed, and they are crying, and you're telling them to sit at home because of COVID. Meanwhile, they make their living by going to the market and selling whatever foodstuff they have. It's going to be very difficult to convince that person. So I think that those issues are hydra-headed, multifaceted. And I'm not convinced that the government has been able to make a dent, or that the government can make a dent in those areas.
I believe that the people are hearing the news, but I also believe that they have so many other problems that it's just passing by them.
Well, let's see how a lot of people begin to, observe these non-pharmaceutical measures and ensure that they keep safe, because that's the ultimate thing. Thank you so much for speaking with us. Consultant physician and infectious disease specialist, Dr. Getty and Yaoke, who is speaking to us from Louisiana, United States. Thank you so much for your insight.
Thank you for having me.